Welcome to the South Asian Environment Dialogue. This is a program where we discuss a range of issues on environment, public health, and as well as developmental issues across South Asia, across the globe. And we keep on discussing. The last week we had discussed the G7 meeting and the fallout of G7 on the climate diplomacy, climate politics. This week we are going back to Corona. I think about a month back, we discussed a series of programs we had on Corona, and we have discussed how the whole pandemic is panning out throughout South Asia. Now, after a month or so, the situation has changed a bit. In some cases, changed for better, in some cases, changed for worse. So let us see, where do we stand right now? We call today's program Corona. Will we just count waves? Just we'll keep on counting waves? That's the big question right now in front of all of us. And as you know, this program is brought on by the Climate TV channel Canada in collaboration with the Plurals India and the No TV Bangla, a major YouTube channel from Bangladesh. Now, today, as I already said, the topic is Corona, will we just count waves? We have a fascinating panel to discuss the agenda. Let me introduce the panel for you. Many of them participated in this program about a month back, and so I think it's a sense of continuity also. They can also understand from where to where we are going on. We have with us today Professor Dhrubojyoti Chatterjee. Professor Chatterjee is a scientist and Vice Chancellor of Sister Nivedita University, Kolkata, India. Professor Chatterjee, welcome to the show.
Thank you.
It's a great pleasure to have you back in the program again. I have with me Professor Dr. Saira AfZal. She's a public health expert and also the member of the Corona Expert Advisory Group in Pakistan. And I had the opportunity of hosting her twice before. So Professor AfZal, again, welcome to the show and welcome for your time.
Good evening. Thank you very much.
Absolute pleasure to have you. I have with me Dr. Ahsina Jahan Lope. She's a consultant and in charge of MH Shamorita Hospital and Medical College, Dhaka, Bangladesh. Dr. Lope, welcome to the show, and it's such a pleasure to host you in today's program. And it's really, I am looking forward to hear the Bangladesh view from you in today's program. Welcome to the show, Dr.
Thank you.
Lope.
Thank you.
Great. I have with me Dr. Kunal Sarkar. I specifically kind of waited to see his now in the late part because I'll be starting with him. Dr. Kunal Sarkar is one of the frontline cardiac surgeon in India. And apart from that, more importantly, I believe, he's a prominent, one of the frontline commentator on the social issues across the country, particularly public health in recent times. And I'm very happy to share with all of you. Sarkar has come up with a wonderful book. Somebody was asking me where he gets time to write such a voluminous book. The Sickness of Health. The Sickness of Health, this has been released, I believe, yesterday. And thank you, Dr. Sarkar, for really focusing light on something which is always being normally kept out of the focus. So it's just a pleasure. And I'll be very happy to hear a couple of lines from you regarding this book. But before that, also we have Professor Rajeev Gupta. Professor Rajeev Gupta is a public health expert from the Jawaharlal Nehru University, Delhi, India, and also member of various committees of Government of India on vaccination. Professor Gupta is engaged in a meeting, the government meeting, and expected to join anytime with us. So we'll be waiting for Professor Gupta to join. But before I roll on and kind of ask Dr. Sarkar to make comment, I'll just have couple of comments with you, all of you. First, where do we stand on Corona? In India, about a month back when we were discussing, I think we were crossing 4 lakh per day. I think I can have the data, 8th May 2021, 4,03,400 on a day. Now it has been almost 9 to 10 times down, 45,000 in 2nd July. That is yesterday. It's a positive news, but also in some places, Maharashtra, Kerala, again, the trend shows to be going up a bit. And there is talks about third wave, which we'll be discussing. If we go to Bangladesh, Bangladesh is really in a bad shape right now. After various up and down, now Bangladesh, I think, recorded 8,483 on 2nd July. That's very, very high. and it is one of the highest peak in Bangladesh. I could see the earlier highest peak is in April, it was 7,600 odd. So really, really going up and up. Pakistan, on the other hand, is on the downward trail. Professor AfZal, you are now about 1,400 on 2nd July. So that's something good news. So India and Pakistan on that end actually kind of complementing each other, going down a bit right now, but Bangladesh going up. Now, WHO has said officially that the new Delta plus strain, that strain is now going to be the globally dominant strain and already in 100 countries. And just 10 hours before, we have just received the agency reports. WHO has formally said the world is in a very dangerous period. So that's the observation of WHO right now. I'm reminding it, but many people across India perhaps thinking, okay, it's going over, Corona is going away. It's not really that, WHO said. And I will finish my introduction with what Dr. Kunal Sarkar has stated, the last 2 lines of his book. I was going through that book briefly before just before the program. Will COVID be relegated to history by the autumn of 2021? We live in hope. Dr. Sarkar, up to you to say how much the hope is actual.
Jayanto, you've always been a great friend, and thank you. Amongst one of the first positives I got out of the pandemic was I had started scribbling. I had done 3 successive lectures on history of healthcare and healthcare delivery on India. And one day my wife got a bit annoyed with me, which is not very unusual. And she just said that instead of chatting around the same lecture repeatedly, why don't you scribble it down? So I said, it's a great idea. And I'm a little bit of a history worm. So I sat down and I figured out it wasn't that difficult at all. Actually, you see, to cut a long story short, healthcare is like a pet in the family that everybody wants to have and nobody wants to care for. Right? So when you are in need, we all want it, but who's actually going to care for it? That is an important question. And in the evolving subcontinent that we are in, which had a very traumatic beginning, the trauma has not really been soothed by a healthcare which has more deficiencies than attributes, depending on wherever we are. Now, since I happen to be in this part of the subcontinent, I've highlighted this part of the history. And basically, I focus on healthcare on India ever since the colonial times, right up to the pandemic. I stopped up to the vaccine. And apart from, I do not pretend to have neutrality because I think neutrality is a dangerous position in today's world. I've tried to give in my perspective, but at the same time, it also has a sense of pathos, the sadness. As a down-to-earth healthcare worker, we have to struggle through this scenario. But I'm sure all this nitpicking is to have a better tomorrow. It's to have a better tomorrow because now healthcare is figuring in the political agenda.
Exactly.
And I'm sure, the more we keep chipping at the old block, we are going to carve something out. And thank you for mentioning.
Let me kind of take up the book. I don't know whether Dr. Sarkar is having one with him, beside him, but I have with me one copy. So this is that book he is talking about, and I'm really hopeful that the thoughts of Dr. Sarkar will kind of percolate down, will kind of have a bit of a trigger among the people, the decision makers who take a call on this system. And as he very rightly pointed out, that healthcare is often be the subject which we keep at the back burner. So thank you, Dr. Sarkar, for coming out with this wonderful book. And I really hope that it's really will kind of trigger what it should have been triggered. Okay, having said that, before anybody else, let me go to Professor Chatterjee, because now this Professor Chatterjee's Delta Plus is doing havoc. I just quoted WHO director's position, and he said that Delta now is about in 100 countries. It's going to be the dominant one. What do you think about it, Professor Chatterjee?
Yes, I just wanted to remind you that at one time we're thinking about what about all these strains, what points and other things are actually carrying the information. But now we understood that when we are talking about the Delta variant, which is normally we call as B617.2. which is largely responsible for the second wave of the COVID-19 pandemic in India specifically. But this new variant of this strain which has emerged has been an additional mutation. Additional mutation means one particular position, K at the 417 position changed by 10 mutation in the spike protein sequence.
Okay.
What does that mean? Why it's going to, actually we are going to have so much of differences between
your network maybe is causing a bit of
417, can you hear me? K417N mutation in the spike protein sequence was already reported earlier. It was associated with the enhanced hospitalization and mortality due to COVID-19 in South Africa. Normally we call that as a beta strain. And also the gamma strain, which was found in Brazil. In both cases, this particular mutation is there. In our delta strain, this mutation is not there. So when the combination of these two mutations are together, that is on the delta, you have additional mutation like this, then it actually makes the whole strain very contagious and to have the ability to infect the people who are already vaccinated.
Okay. So it
now
can
over
also
here, just before I just wanted to mention, because it is very important, because I learned it from Dr. Sarkar in earlier, that the relevance of this mutation along with that, how it's going to happen. You know that now Trump started with the monoclonal antibody. That monoclonal antibody cocktail right now is available throughout the world. In India, it cost around 50,000. It already started over here. And this monoclonal antibody cocktail was found to be totally failure against Delta Plus variant.
Okay. Professor Chatterjee, I may request you to, if it is possible, to use mobile or any other kind of connectivity, because your sound seems to be having a bit of a problem. Network seems to be having a bit of a problem. So let me go to Professor AfZal. Professor AfZal, what is about Pakistan situation? I think we are talking about third wave, but you are already going through that. What's the situation in Pakistan right now?
Yes, Pakistan, the situation is very well controlled. And as you have already said that we have only 9,061 thousand cases in Pakistan. And luckily our wave that is over. And we have in 24 hours only 1,400 cases. And in Punjab particularly, we have only 128 cases. So if I talk about positivity, because whenever we talk about situation as epidemiologists, we are looking towards the cases and how they are being considered positive. So all positivity has declined to just 0.9% in Lahore. And it is in all the cities, it is much less than 5%. So here we have a very comfortable position. The main concern is about the mutant or the variants of concern. As we have known that Delta and the Delta Plus, they have been more contagious. So all our strategies are now focusing on decreasing the transmission of any other variant, either variant of concern or mutant. As NCOC has announced, only 20% of the flights should have their capacity as previously. So it is not more than 20%. Second important thing, we all know that it is not the money or the resources that matter. It is actually the strategies, the policies that matter. So
Absolutely.
our mitigation and surveillance policy, it has been taken into ring vaccination. If you take the whole number, it is only...
I'll come to vaccination, but just a quick supplementary question. You were talking about the strategy, Professor AfZal. I believe that you had quite a long lockdown period. Do you feel that particular strategy actually has contributed in kind of taking the number down there?
Yes, our strategies are basically TTQ strategy, that is the tracing and then tracking and then producing a quarantine for that person. And after doing this strategy, we have a very strong strategy of closing the schools, institutions where there is most of the spread is there. And these strategies have worked very well for Pakistan and particularly for Punjab, because 50% of the population of Pakistan is in Punjab. We are very lucky that our strategies have worked very well as far as
hopefully this trend will continue. Hopefully, you all hope that this trend will continue. But the trend is not at all good, Dr. Lope, in Bangladesh. We heard that Pakistan is doing well right now, but Bangladesh, you are going up and up right now. So what's the situation in Bangladesh, Dr. Lope?
Thank you very much for inviting me in this prestigious platform. Actually, yes, it is getting worse from the late June. You know, in Bangladesh from 8 March 2020, actually, we had the first wave in Bangladesh. But the second wave we got, that is the first week of April, and the situation getting better by mid-May, because of there was a good lockdown at that time. But because of our some Eid vacation, that's a religious issue actually. So lockdown become bit reluctant at that time. So what happened that in Dhaka, the capital of Bangladesh, the case is reduced. But when the border areas like you know the Rajshahi and the Khulna, where the port and others, so we are then we found the lots of cases in those peripheries areas. So that is the most scary scenario now, because the people are actually they are knowing nothing, and they are just getting they're having fever and cough, and they're having respiratory distress, and people are dying. So this is a very I know that today also the death is 132. And I can say that in Rajshahi and Khulna, like we have in 24 hours, Khulna is the highest death rate, that is the 11% today, 11 death. In Joshua also that's 8, in Kushtia 5. So I think in 24 hours, it's a scary scenario.
So it's not really a very comfortable situation right now. And
no, not comfortable.
Bangladesh, I think Bangladesh is right now under very strict lockdown, isn't it?
Yeah, from yesterday in Bangladesh, it's not lockdown, it's totally shut down. The government has announced, Bangladesh government, all the government and semi-government, autonomous and private offices will be closed. The ban also applicable for airports, land ports and maritime ports and other offices. And actually when in the previous lockdown, it was a bit reluctant. People were not listening.
But now it's a complete shutdown.
Yes, complete shutdown.
Okay, it's not really very comfortable situation. Dr. Sarkar, we have been talking about this third wave now quite some time. There have been various opinions, a set of experts saying that third wave will be huge. Some are saying not really that big. Some are saying the children are going to be affected. At the same time, there are queries about vaccination. We'll be coming to the vaccination later. But as of now, what's your take on the third wave? Where do we leading to? Are we really going for again another big wave, or you think it will be a manageable one? Dr.
Jayanta, I really, I learn a lot by listening to people. And the other evening, I was listening to one of our most noted epidemiologists, a young man, Dr. Ahsina. He was on one of the web platforms, and he made a very poignant comment, which stuck in my head. And that was that third wave is going to be a wave of behavior. It depends upon the behavior of the people. It depends upon the behavior of the government. Right? And he put it very aptly. Because look, there is no point crying over spilt milk all over again. But honestly, the mess that we were in, the super mess that we were in the second wave, was honestly largely provoked because of our, overwhelming stupidity. All the reasons why it happened. Now, for the third wave, the important points, Jayanta, is that you see there has been certain very visible changes from our management first time around. And that was, we gave up the sort of pan-India strategy. And all these restrictions, lockdown, essentially, I'm sure our friends in public medicine will agree with us. The lockdown is the last resort of the destitute, basically. That non-public health kind of intervention, you apply it when almost everything else has failed. But in this respiratory pandemic, I don't think many countries, the nation in Sweden, which still stands alone in the world, which have never to have lockdown. They are a lonely exception. But that's the way it was. Now, I think a combination of facts, which is the public has had a big shock therapy. It's very funny. If you look at the official statistic, not funny really, it's very uncanny rather, that if you look at the Indian lives lost in India during the 5.5 months of the first wave, it is a so-called first wave, is exactly the same as the lives lost in 2 months of the second wave, right? Exactly the same. And in sort of numbers of cases detected, we are about officially 3 times more or 2.75 times higher. I think unofficially, for those of us who bear the heat in the healthcare sector, we think it is at least 4 to 5 times higher.
Okay.
But let me just wind up by saying one thing. I think if we don't provoke it, the fact that you'll come to vaccination later, that we've had a decentralized strategy, which I think is a good thing second time round. And the most potent virus in India, India has to struggle with 2 viruses. One is called SARS-CoV-2 and the other is called the EC virus, the Election Commission virus. And against SARS-CoV-2, you have a vaccine. Against the second fellow, you don't have a vaccine. So if you keep the second fellow quiet till between now and October, that we don't, break up into a democratic dance of joy over 2.5 months here and there, then hopefully we are going to see upsurges of infection, mind you. We are. But we cannot do the same thing as we did in Maharashtra. Because remember, the second wave started in the rural part of India, not in the urban part.
Absolutely.
We allowed the second wave to infiltrate Nagpur, then Pune, then Mumbai, and then Helsinki. And even if you look at the distribution right now, it is very likely that we are going to have few angry pockets coming up in various corners of India. How alert, how proactive.
Will they be mainly rural and peri-urban pockets?
Yes, very, very likely, very likely.
Very likely.
You look at the statistics from Kerala now. What's that? You see, Kerala has no villages. Kerala either has highly developed cities or less developed cities. There isn't a single village in Kerala. So that is why Kerala is finding it so tough to control numbers. There are no villages.
Very important cog in the wheel is the vaccine, which will come back later. But as you said, that there is no vaccine for the EC. But I think SC is some kind of a vaccine for EC, as we found in the some time back, that SC is really playing a bit of a vaccination role. Professor Chatterjee, we were talking about the last time the role of Delta and all that. Now this rural pockets of India. I think you are muted. You have to unmute yourself. The rural pockets in India, Professor Chatterjee, where you neither have the system of testing, nor have in the proper way, nor having enough vaccination. Are the sitting ducks, or is the village, are the villages of India are sitting ducks to the third infection? Professor Chatterjee.
Yes, but one thing I just wanted to mention to you, that in the second wave, after the second wave is there is a seropositivity testing done all over India by ICMR to find it out, the infiltration of the infection in the rural population. During the first wave, it was found to be 10.6, whereas in urban it is 25. But this time in the rural population, it was found to be almost 32.6. That means, though we have not seen so many people who have gone to the hospital or anywhere else, but we could see there are silent infection in a huge population. And among them, another interesting feature was found that
are they silently dying as well?
no,
silently dying as well?
It's not dying because seropositivity tests are being done. From silently dying or not, I cannot tell you. But
because we could find the dead bodies kind of floating in
that
Ganga.
we could not. Yeah, but that we have not seen. But what we could see that this seropositivity test has been done on the living person who are actually moving, working, doing all sorts of things, but they have the antibody against the virus. That means they must be exposed to the infection. So that is one of the very interesting observations we started to see during this second wave, that the rural population started to get this particular antibody in their circulating blood system. And another interesting point I want to mention over here, and in both the cases, it was found that around 10.5% of children between the age 8 to 12, they got seropositivity also. That means it is not, it's earlier also, the infection started in the second wave also, but the manifestation of the infection in the kids are completely different because of the many other reasons over there. But what I could find it out that now in the rural population, it started infiltrating, and there are quite a big number of people who are getting infected.
No, I'm provoked to ask a quick supplementary question out here. You said that the children were also being affected before, but the manifestation was not in that manner. But now we are seeing the manifestations. Are the mutations something to do about it? Or this Delta Plus, they have been behaving differently right now as they behave compared to what they have behaved in perhaps the first and second wave or first wave?
See, Delta Plus informations are not there among the children. So it's all the information what I am mentioning to you. The increase in manifestation is in the kids during the second wave itself. But that manifestations are something which is quite different from that of the adults. And they are being affected in a different way and major the gastrointestinal disorders.
Okay, so these are very, very important, I think, inputs. With that inputs to Professor AfZal. Professor AfZal, what's the take? What's the situation in Pakistan? In India, we are talking about the third wave coming up, and we are also talking about the possibility of the children will be getting more affected. What is the situation out there? In your case, are the children getting affected as well, Professor AfZal?
In Pakistan, as we have seen that we don't have Delta Plus variant still in Pakistan. So it has been reported in other countries. We are very suspicious that it may not travel to Pakistan. That's why our border control measures that are much strict now. And I have told you that all the airlines, they are very vigilant about it. The second important thing, again, you would see that the vaccination is the only solution. And we have seen the very good response to different types of vaccines, even the Chinese vaccine, we have AstraZeneca vaccine, now we have Pfizer vaccine, Moderna vaccine. So our population has responded very well to vaccination. Our number of vaccination is still very less. According to the official figures, it is less than 14%. But the strategy, it is very important. We have vaccinated all the high-risk groups, all the doctors, nurses, paramedics, students, teachers. And now we are doing ring vaccination. Again, a very important strategy that was used by William Force. Now it has been used in Pakistan. All those cases where the positivity is more, they are pushed to have vaccination. All those people who are being traced to have corona positive, they are being given vaccination at priority. So all these measures are helping us in decreasing our viral load here in Pakistan.
Okay. How many vaccines are available in Pakistan right now? How many vaccines kind of?
Right. We have a lot of vaccines that are available now. We have Sinopharm, Sinovac, we have
Chinese one.
We have Pfizer, Moderna, and also AstraZeneca. And the people who are being given in private sector, it is Sputnik vaccine.
Okay. Also Sputnik is there.
But you have your indigenous one also.
Do you have any indigenous one, Professor AfZal? Has Pakistan prepared any your own vaccine?
Yes,
Making Pakistan vaccine?
Yes, Pakistan is preparing a vaccine that is called Pak-Vec vaccine. It is actually the Sinopharm vaccine. And the formula is the same as the Sinopharm vaccine. So we are being helped by our neighboring country to prepare our own vaccine that is Pak-Vec.
So you have enough, you feel that now Pakistan has enough vaccines for the time being to vaccinate its people. So you are happy with the situation right now about vaccination?
Yes, we are very comfortable.
That's another good piece of news, because there are talks about the kind of discrepancy throughout the world about vaccination. Some countries are having it, some countries are not having it. What about Dr. Lope in Bangladesh? I think India has put you in a bit of a trouble by not giving the second dose of Covaxin. We all know that. But what is the situation right now? I'm told that now you're getting vaccines. What is the situation, Dr. Lope?
Yes, we are getting vaccines, but total vaccination in Bangladesh till now, that is 1,17,709,000.
What is the percentage? What is the percentage?
Percentage very low, because we have 17 million total population, and I think it's less than 2%. So this is very, very low, but there is a good news that 1.2 million doses arrived from Moderna, and total 5.5 million doses are available from also Pfizer, Sinopharm, AstraZeneca, both we have. But what happened from at the very beginning when we started vaccination, people are not that type of motivated. So that was a problem also. So we are slow when the pace of the vaccination. The time we get vaccination done, we might face a newer and more resistant virus.
Okay. In fact, what Dr. Lope said, I'm just throwing this question open to all of the panelists, is that it seems that it's now getting difficult for having 2 doses of vaccines which are meant to be having 2 doses. And now the experts are talking about the mixed vaccination. Some countries are trying it out, that having 1 dose of AstraZeneca, another dose of Pfizer, and likewise. So before I go over to Dr. Sarkar and then Professor Chatterjee, very quickly to Dr. Lope and Professor AfZal, that any thought about mixed vaccination as of now in your respective countries? Dr. Lope, to start with. Any thought about mixed vaccination? Because you don't have Covaxin now. You have Covaxin, you have vaccinated people with Covaxin, but as of now, you're not having Covaxin. So any thought about giving another?
No, actually, we are not thinking about the mixed vaccination, because the Covishield, because this is a less amount, so we are giving only the second dose who are due. But the new first doses, we are giving the different, like Pfizer and Moderna.
So no mixed vaccination as of now?
No.
Very quickly to Professor AfZal, any thought about mixed vaccination?
Okay, being a member of Corona Expert Advisory Group, this was a question that was put to us, that if the cocktail of the vaccines are being given to the people, how would it work? But we have not recommended it, because we have a sufficient supply of the vaccines. So preferably those people who are having the Sinopharm first, they are getting Sinopharm. Similarly, those who are getting the AstraZeneca, they are getting AstraZeneca.
So no mixed vaccination.
The point is that has to be noted very well is that this mutation could cause more and more vaccination doses to be given. It is not only the 2 doses. Please, you can write my words. You have to give the vaccine after every 6 months. Whenever there is a new mutant.
Professor Chatterjee, please take note. I'll ask you on this. Professor Chatterjee, please take note.
It or not.
Very important point being raised by Dr. AfZal, that you don't be happy with the 2 doses. You have to have doses in your hand. And that is something many experts are talking about. Thank you. Many thanks for flagging up this question, Professor AfZal. Dr. Sarkar, in India, when we are talking about vaccination, we had been criticizing the central government not for arranging adequate vaccines. At one time, we were kind of looking the vaccine guru. We have been providing vaccine all over the world. And then we find that our back end, there is no vaccine. So a lot of criticism the government of India had to face. But now they have officially went to Supreme Court and said that by December, all adults will be vaccinated. And by the ground reality, by the kind of vaccines we are having now, the access to vaccines and the newer vaccines which are being now kind of planned in India, coming to India, what's your take on that? Is it realistic that the entire Indian adult population will be vaccinated by the end of this year?
Just a few quick points. You see, if we recap what is the vaccine status in India, One is we have managed to give about 20% of our population, which is India has given the most vaccines in the world, wherever. And say we have also given the most number, with the exception of China, which claims to have done 1 crore a day, which is 10 million a day. We probably vaccinated more than cumulative amounts of either United States or United States in a day. But if you look at our population distribution, see, we have covered about 20% with 1 dose, about 4% with 2 doses. But the good news is that we have covered about 60% of people in the 50 plus and the high risk category with both doses. So I think that is one thing. The other problem is that we are aspiring. You see, the government of India had announced a target way back in, I think sometime in April, saying that, they presumed a very simple presumption. Their presumption are that about 30 crore people would hang around in the population who have had some kind of post-infection immunity. And they wanted to have 30 crore people vaccinated, which comes up to about 60 crore doses. And they set for themselves a timeline, which was the end of July. Now, very surely we are missing the target by end of July. We won't get to 60 crore doses because it is already July now, and we have just moved beyond the 30-35 crores. The other problem is in the supply side. You see, when India started vaccinating, we wanted 2 billion doses. You did not have 2 billion doses in the world, right? That was one part. And then we kind of messed up our ordering and the other things. But currently, if I add up, if you and I add up, what is the supply side per day? The supply side per day is showing, on a good day, it is showing around 45 lakhs. On a bad day, it is showing around 40 lakhs per day. So at this point of time, unless we have a gate crasher into the scene who's injecting, something like extra 10, 15 lakhs, etc. per day, we are finding it a jolly difficult to exceed 50 lakhs per day, 5 million per day on a consistent basis. So I honestly think, if you look at the numbers projected on the wall, that I think it will be nearly, if we get to near about the 60 crore doses, say sometime by the second half of August, we would have done well. We would have done well. And the others, there is a lot of hanky-panky going on, 216 crores and all that kind of thing. Because that doesn't make sense, because you don't have that kind of vaccine supply. You cannot have vaccine inventory. And but another crucial issue for India at this point of time is to keep an eye on the peer group phase 3 data of Covaxin. Covaxin has this bad habit of always publishing reports and not peer group data. So they are a little bit like Indian doctors, who always say that we are so brilliant, we don't need publications. So I'm really looking out for the stage 3 data. And the last point I wanted to make is that with the exception of United States, which is now claiming to have 25% of Delta penetration, United Kingdom, which has 50% Delta penetration, our the rate of genomic analysis honestly is very low. So we are sort of awestruck by Delta and the rest of it. But honestly speaking, we are not hanging on to a lot of hard data. That we are about, I think we are somewhere, I think Dr. Chatterjee will know, we are somewhere around 0.05% of genomic analysis. Though the number of
less than that.
And the number of labs have increased, mind you. That INSACOG used to have 25 labs. Now it has increased. They have added another 10 more or something. So the bottom line, Jayanto, is that we really need some of our own data, because sometimes I feel that people in the Central Committee still haven't got the news that the British have left the country. Because all the data I have seen discussed, honestly speaking, you look at all the data that has been discussed in the last 1 month is a cut and paste of the British data. So if you get to identify the gentleman, you point him to me, I will send him a tweet saying that the British have left the country. So let's have our own data and see where we stand.
Why don't you,
all Delta data is essentially UK data. You know,
why don't you tag our Honorable Health Minister? Why don't you tag our Honorable Health Minister?
Yeah, I've got a good mind, you know, then they'll probably beat me out of the country, then I have to ask Lope for a job, you know, that's the problem.
You tweet, I will retweet. You tweet, I will retweet. But Dr. Sarkar, before I go over to Professor Chatterjee, a very quick response. Still many people, even within the doctors, I am not taking names, but there are doctors who are talking about the efficacy of actually the vaccine's efficacy. I have heard doctors talking in the public forum about the so-called efficacy of vaccines. According to your experience on ground level, the doctors and the frontline health workers who have taken the vaccines, the 2 doses of vaccines, you feel them are more protected? They are being less affected right now? Dr. Sarkar, what's your experience on ground?
You see, we have to, this is very similar. We are actually discussing a statistical paradox, you know, which is not very dissimilar from somebody came up, jumped the gun and said, in the 3rd wave, we are only going to see children, you know, as if this was the plague of Moses or something, which visited house to house and picked up children. No, this is not a biblical disease, you see, it doesn't happen like that. So because if you have the total number of affected people multiplied by a factor of 5, then plain and simple, you're going to see 5 times more children anyway, because children being children are still a part of the population. That's point 1. And the second question about the efficacy, you see, there are at least, Dr. Chatterjee will also know, there are 2 or 3, not very voluminous, but there are 2 or 3 important studies which have come up from Indian military, Indian railways, and some other population, which honestly echoes the efficacy data, which is like 1 in 20,000 prevention of infection, which is 1 in 50,000 prevention of death. But the trouble, Jayanto, is that 20,000 is not a huge number for our population. 2 streets added together is 20,000 people. So across 2 streets, you are going to pick up some unfortunate character who had severe disease post-vaccination, and we highlight that. I think that is a little bit naive.
Exception can't be the rule. Exception can't be the rule.
Yeah, I'm aware of the lecture you refer to. But Indian doctors have a bad habit. I've written in the book, which is we are all taught by medical representatives, by the pharmaceutical industry.
I don't want to make further comment in public domain, but that was very unfortunate because many people kind of called me up and saying that these doctors are saying these things.
A very silly comment, but there you are. It takes all in the world. So.
Absolutely. Professor Chatterjee, so many questions about the efficacy and other things coming up. Very quickly, if you respond to one by one. First, this idea of mixed vaccination. Many countries are apparently thinking about it. I think some countries have started it as well. The mixed vaccination, having 1 dose of one vaccine and another dose of another vaccine, scientifically, how kind of relevant is that thought?
Yes. Now, you know that the vaccines which are there in the market, there are different categories of vaccines. Covaxin is the one which is actually the oldest traditional category where the enterovirus has been used. So the antigenic antibody response is against the whole virus. But when you are talking about the messenger RNA-based vaccines, there we are having the specific spike protein messenger RNA thrown into the system, and it is the antibody against the spike protein has been raised. So you can see the one thing is that against the total virus, and another is against the specific spike protein virus. So now, according to the theoretical scientific reason, the messenger RNA vaccine, you can make a combination of with another messenger RNA vaccine. There are 4 messenger RNA-based vaccines right now. So these combinations could be okay because both are actually acting in a similar fashion. But if it is a Covaxin, which is a total antibody against the total virus, that will really not going to complement with this one. So that will be the 2 individual vaccines. It's not going to be the 2 doses of the vaccine. So you have to say that 2 individual vaccines are given by the, so there is no question of, so we have to understand the nature of now the DNA vaccine which is coming up from the candida. So that is again, which is completely different. Only one very interesting feature we could find in case of the Johnson & Johnson vaccine, which is a combination of 3 different proteins, which almost mimic with the viral total antigenic proteins. Johnson & Johnson, that's why they suggested only a single dose for that. So Johnson & Johnson vaccine, they said single dose. But now you know that there are so many negative points coming out of this Johnson & Johnson vaccine. It is really very difficult to comment on that, because already the study, already in different parts of the world, we have several different types of...
And government of India is not allowing it as well.
Not because of that reason. There are so many difficulties out there. But as Dr. Sarkar is mentioning about the Covaxin one, you know that Covaxin one is a very traditional one, and it is actually the way it has been done. It's a traditional way of preparing the vaccine against the viruses. And right now, the Covaxin trial 3 results are ready, but already the government started that because the Covaxin trials, the people who received that 2 doses, already 6 months been covered. So after 6 months, what's going to happen? So there is a...
there are some figures today. There have been some figures today that 78% efficacy being talked about.
So that is actually, it increased a little bit. So this percentage, I am a little bit skeptic after hearing you, Dr. Sarkar, because you know that they said 82% for this, 78.8% for that, all these things. But what I want to mention over here, right now, the 3rd dose for the people who already received 2 doses, there will be a trial started already with a small population. And we people are waiting for that, because that...
Professor AfZal was talking about the multiple doses, more than 2. So you are vindicating that point that there will be more doses.
Yeah, after 6 months, another dose to be given. Because, you know, the vaccine and the circulating antibody, if you look at it, many of us who receive both doses, in our body, we don't have any circulating antibody. So it says that most probably it has gone to the memory cells. So it's those cells are going to produce antibodies whenever I'm going to get infected.
I have another couple of scientific questions that Science has published. I think today I have seen it. Science has published.
Can I make one point?
Sure.
Yes.
Just 1 minute. You know, I think it's just relevant to what Dr. Chatterjee said, that when we look at the attenuated virus vaccines, you see, that, look, vaccines are very important and on that, absolutely right. But we remember there are 4 places in the world which are actually staring down a vaccine failure, right? And these are the places of Bahrain, Venezuela, Seychelles, and Chile, right? And all these 4 countries where they had actually vaccinated thick and fast, a large percentage of their population. Now, I have nothing against China. I was for once in a while shouting and saying that when we were awfully short of vaccines, we should get Chinese vaccines. But there are, we need, that is why you see, the question is we need hard data coming out of the Covaxin lab very soon. And wherever in the world you've had other coronaviruses exposure before, like SARS-CoV-1, etc., the conventional thought is they actually linger in the system for about a year. You know, they do. But this is not, this virus manufactured in a lab and not in the lab of nature. This behaves in a bizarre kind of way. This is the first time in, I believe Dr. Chatterjee will bear me out. This is the good part of the bad news is that the Wuhan lab has given us a target to aim at, because the only part of the virus they filled with was the spike protein, right? So each and every vaccine today is just aimed at the spike protein, the CGG codon or what the furin cleavage site, whatever you call it. We are all aiming for that one site.
I think very, very important issues that and what happened in Wuhan is anybody's guess. But generally, I'm not kind of triggering discussion on that. But when you speak to public health experts across, their general idea is that Covaxin, because as you said, Professor Chatterjee, is a vaccine, the entire body vaccine. it may be more resistant against the variants. That's something being also, some US experts have been corroborated that it may be more effective against the variants. So I think there's a mixed bag. So what way Covaxin will work, Covishield will work, there's a different ballgame. But I'll come back to Professor Chatterjee with that question, that there's a publication in Science which is saying that somebody who is having a corona episode followed by a vaccination, that's the best kind of model of immunity. I'll come back to you on that point, but let me go to Professor AfZal. Professor AfZal, what next? We'll keep on talking about these waves. You feel when this world will be kind of have a freedom? I think US is announcing a date of freedom from corona, when the world can announce a freedom date from corona. Professor AfZal, when Pakistan can do that?
This is one of the most asked questions, when all this will end. And we all are looking forward for ending this everything. But being a scientist, we have to speak the truth. Actually, it is not going to end. It would happen again and again, because the vaccination, as we are looking at it, it is much slower in some countries rather than in other. Globalization is there. There is so much traveling. So the border control measures can be temporary, but it can't be permanent. Moreover, the complications, in our last episode, we talked about black fungus, and now we have seen so many thousands of cases of black fungus in India, and similarly, hundreds of cases in Pakistan that we have never witnessed before. As a physician, I have never seen so many cases of black fungus in my whole life as I have seen just in few months. So the end game, it is not near. And believe me, the complication rates, they are still coming up. In multi-system inflammatory disease, encephalopathies, encephalitis, transverse myelitis, pancreatitis, even after vaccination, myocarditis, pericarditis. So there are so many complications of this disease that the end, as we are looking forward, it is not so near. So we have to be prepared. As far as efficacy is concerned, I want to answer that question too, because it is again a wonderful question. Whenever we talk about vaccine, we have a separate efficacy for each and every vaccine in each and every region, in each and every country. So it is not a single efficacy that is reported for any vaccine in whole of the world. For example, if you talk about Sinopharm or Sinovac, it may be 62% for one country, and it can be 86 to 90% for another country. So the efficacy, yes,
very
it is
important, very important point.
But the most important point is the vaccination. All those people who have been vaccinated, the good news is there is no death reported from that country. Not from Pakistan, not from UAE, not from India. All those people who have been vaccinated, they are not going to have the critical disease, or they are not going to land up in ICU. So this is the best efficacy that we can report. Instead of telling the numbers, we should tell the people or the public that it would prevent the death, it would prevent the ICU admission, it would decrease the burden on the health resources. However, the complications, yes, it has to, we have to be more vigilant about it. Surveillance systems should look into the complications. But two important things: after the vaccination and before the vaccination. And then we will have more evidence about it.
In fact, I really would love to share an interesting comparison that somebody shared with me, that compared to the fast kind of rise in India, during the second rise, the number of doctors and health professionals and frontline workers on health, the number of deaths, the mortality rate was much lower, because the fact they had a couple of doses of vaccine. And secondly, the journalists died more. The number of journalists died during the second dose, second wave, so-called second wave across the world, including in India, was phenomenal. And it is said that because the journalists were not included within the frontline workers, they kind of had a sitting duck and they actually suffered. So it's a very interesting pointer that how vaccination can make a difference. Dr. Sarkar made a very valid point that somebody may be actually affected, but that's an exception. If you take a database, if you take a sample, then you understand that, yes, vaccines give you protection. And I think health professionals and frontline workers on health, the number of deaths, the mortality rate was much lower, because the fact across the world should keep in mind that proper doses of vaccine. Secondly, the journalists died more. Then the number of journalists died during the second dose, second wave, so-called second wave across the world, including in India, was phenomenal. And it is said that as because the journalists were not included within the frontline workers, they kind of were a sitting duck and they actually suffered. So it's a very interesting pointer that how vaccination can make a difference. Dr. Sarkar made a very valid point that somebody may be actually affected after having 2 doses, but that's an exception. You have to, if you take a database, if you take a sample, then you understand that, yes, vaccines give you protection. I think people across the world should keep in mind that proper doses of vaccines, if taken properly, then it should give some kind of a support system, some kind of an immunity to the exposed people. Let's go to Dr. Lope on that. What is going to happen? Dr. Lope, are we not traveling? I'll not be able to go to Bangladesh, and you will not be going to anywhere in the world, and we'll be stuck in our own places because, as Professor AfZal has just said, that it is going to stay back. It's going to stay back can be 2 kinds of. One is the indigenous kind. It becomes an influenza kind of vaccine. You take an annual dose and you are fine with that. Another is it remains the big elephant in the room as it is right now. What's your take on Dr. Lope on that?
First of all, I want to share one thing that this time what we are actually experiencing from last 1 week, the severity of the disease is very, I don't know, it's dangerous. And which group of people, like the children, which we discussed before, the children group, pediatric group actually, and the pregnant women, they are affecting more from the first wave we experienced. So this is very, and in Rajshahi or Khulna, one of lab, all lab technicians got affected and the lab is closed totally. So these things are happening in our rural area, in the peripheries. So I think it's the strain is different from before. So this is the 60% variant is now Delta variant in Bangladesh. We all are going through this.
Are you carrying out genomic studies?
I think,
no, we are not, but we are now research and all these things are on the actually.
Is somewhere in the 4th century BC, when Greek and Sparta was fighting one another during the Peloponnesian War. And from that time onwards, you see, whichever pandemics have come, if you want the good news is all the pandemics have actually ended. But the bad news is that once in a while, say about 50 million years ago, there must have been something or the other that wiped the dinosaurs out, which are called the mass extinction event. So what are you actually looking at? Are you looking down the barrel of the gun, or you are looking at the end of the bullet? That is the question. No, we are not sure completely, but by the look of things, this being a respiratory pandemic and for all intentions and purposes, this being a creature of the human devious mind, I think the vaccines will work. Because you see, so far, look at the world. The world population is about 8 billion.
Yes.
So far, about 2 billion people have been vaccinated. So if you look, at least 1 dose given is about 25% of the world population. Yes, it is not evenly distributed.
So vaccine is the answer. So vaccine is the answer in the beginning.
It is not evenly distributed. But I think, this will, now the question is whether you and I are alive to see the end. That's the important bit.
That's the big question. That's the big question.
Yeah, it will become like a seasonal flu, sir, like the Spanish flu, I think. And
that's
with
fine.
yearly vaccination,
seasonal flu is fine.
Seasonal flu with yearly vaccination.
Mortality, that it's difficult.
Yeah, but I think, but the other important thing which is happening around us at the moment is that we really need. I think when you discuss G7 and all these effects tomorrow is, I mean, in the last program when you discussed. The important thing, Jayanto, is that through forums like this, we must start a little bit of civilized dialogue to say that hoarding of vaccines is bad.
Yes, absolutely.
There are
absolutely. I think we need to do something, a very, very important point, and I'm really finicky on that, the way some countries are hoarding the vaccines and some countries are not getting it.
That should be,
it's uncivilized. It's not really.
Highly discouraged.
UN should do something about it. United Nations should do something about it. Professor Chatterjee, I will end up with you. We have couple of minutes with me. First, very quickly respond that, do you subscribe to this particular finding that if somebody has COVID and then he or she has bouts of vaccinations, are they more protected? Hybrid vaccination kind of?
Yeah, so what I'm saying that there are two things. One is that you have the first dose and then you get the infection. So the infection will actually work like a second dose.
Yes.
All right. So the immunity boosting up will be very, very good in those people. Already number of people being studied in that respect. The opposite, the one which you are mentioning about, that you have the infection and then you wait for 3 months and then you have the first dose, which is actually going to be considered as the second dose of the vaccine. Because so already your body
will add to the immunity.
Exactly.
Exactly.
And,
so we have as a scientist, how, Professor Chatterjee, you look at it, this pandemic, what's your gut feeling? Is it going to stay? I'm not saying stay. It may stay, as Dr. Lope is saying, but the stay that right now we are often all brought on to the knees and being stuck within the 4 rooms. Is it the life we are going to spend, or we'll be better off?
Okay. Over here, I just want to mention that, that normally in the virology, whether that is a classical virologist view or the modern virologist view, we always say if the virus gets its highest potential, then that's the indication of the decay of the viral infection.
Yes.
So now what we could see, that Delta plus variants, transmissibility, infection, potential, and everything is going to be so high. The indication is that this is the end of that virus. Now the other variants which will come, they will remain and they will cause different infection for a long period of time, but those are not going to be very dangerous. But this time, it's an indication, and I don't know, somehow when you read the last line of the Dr. Sarkar's book regarding August 2022, I really thought that this is the most scientific way of prediction that when we are going to get out of this tremendous effect of the vaccine, of the virus itself.
Dr. Sarkar, we will all look towards the deadline. You have kind of mentioned with the question mark. I'm not saying that you have concluded, but I think Professor Chatterjee, the point that end of your submission, your observation is that the vaccine is, the virus is running out of its potential. I think something has also been talked about many scientists, that this Delta has kind of reached the final kind of point of its potency. So we all hope, and we end today's program with that positive note that perhaps the Delta or Delta plus, whatever we look at it and call it, that has come to the almost the final end of its penetrative ability. And perhaps definitely, as Dr. Lope said, Professor AfZal said that the virus will remain. The virus will continue to haunt us. But we may have a life kind of adapted to that virus, having a seasonal dose, and we'll live with that. And today I leave with that hope that, yes, maybe the next autumn, who knows, we'll be perhaps having this kind of meeting in a room rather than in a virtual platform. Thank you, everybody, for your time. Thank you. And we end today.
Thank you so much. Take care.
Thank you so much.
Thank you. Good day.
Species around the world are fighting a silent battle. They are losing their homes. 6,000 acres of the Amazon rainforest are destroyed each day.